Go Local Live. I'm Josh Fenton, CEO and co-founder. If you haven't seen the big news today, Go Local just broke it a few minutes ago. Charter Care Hospital Group is up for sale and has got a new buyer. Can read all about it. It's part of the shakeup going on in healthcare. And I want to jump over to Dr. Phil Chan at the Department of Health. Dr. Chan, thanks so much for joining us.
Thank you for having me.
Dr. Chan, I feel like long lost friends. You've been on so many times, kind of like Saturday Night Live and Tom Hanks kind of situation. Let's jump to it. In 2 days, people are going to be traveling across the country, gathering together, feasting for Thanksgiving, and we've got 1, 2, 3 complications to it. Walk us through these complications and sort of where the Department of Health is worried and what the health department is giving for direction to folks.
Yeah, thank you so much for the question. Let me first start off by saying happy Thanksgiving to everyone, one of my favorite holidays. But I think we're at the point in the pandemic where we just have to use some reasonable judgment about what to do. First off, get your flu shot. So we're talking about the flu, RSV, COVID. Get your flu shot, get up to date on your COVID boosters. Don't go out if you're sick. If you're comfortable, wear a mask. Basic things that we've really been talking about for the last couple of years.
And tell me why this is important. I mean, first and foremost, I just want to go back to COVID for a sec. I'm up to 5 shots, and I'll also say the 5th shot felt nothing. Some of the earlier shots definitely had an impact on me, kind of down for a day. This 5th shot, against the most recent group of variants, literally no effect at all. Playing tennis the next day kind of situation, felt great. How are we doing in getting that 5th shot for these variants? How much adoption is there? And do we know why people who haven't gotten it are resistant to getting it?
Well, Josh, I think that there's a certain amount of COVID fatigue out there. And the reason why we're doing all this, to your initial question, of course, we want people to be healthy, to stay healthy. And on the flip side, too, the hospitals, as we've been seeing in the news, the hospitals are really overwhelmed. So as we try to bring down the levels of these different viruses in the community, one of the major goals is just to prevent the hospitals from being overwhelmed. I've been talking to my colleagues over at Lifespan and Care New England. Everyone's just so tired and overwhelmed, and Hasbro, it's just exhausting for a lot of my colleagues. So anything we can do to protect our hospitals is really critical, because then people start having worse health outcomes, right? The hospitals are over capacity. People who go to the hospital for heart attacks or strokes or broken legs start to have worse outcomes because they're not getting the same standards of care that they would if in normal times.
Is this the worst, other than at the peaks of COVID, is this the worst you've ever seen for how the hospitals are just, we get contacted all the time, we've written on it numerous times. Is this the worst we've seen?
The answer is yes, depending on the hospital. I don't, as an adult physician, I don't practice at Hasbro Hospital, for example, but uniformly, all my colleagues, all the staff at Hasbro Hospital have said that this is the worst they've ever seen it. People that have practiced for decades.
Yeah, not good. So let's tick these off. We talked a little bit about getting that booster shot if it's, up against these variants. That, if you look at the New York Times and look at the national numbers, the national numbers are much better than they've been in functionally in a year. The number of folks who are hospitalized is down significantly nationally. The number of deaths have decreased dramatically. It's still concerning. It's still about 250 to 300 deaths every 14 days. But on the COVID side, is there an opportunity to really push and get everybody getting this last important 5th variant shot?
I would, and I got mine last month as well. We know that these emerging Omicron variants are a bit resistant to past immunity. I would say if you have not had a natural COVID infection in the last 90 days, and you haven't gotten a booster for at least a couple months, then you really want to consider this latest booster. It's going to protect you. It's going to protect you against severe disease, and death and hospitalization. And remember, we're at the point in the game in the COVID pandemic where we're really focused on preventing hospitalizations, preventing severe death, and there's good data that these vaccines continue to do just that.
Okay, check the box for COVID. Let's go over to the flu shot. Generally, in an average year pre-COVID, Rhode Island has performed as well as any state in the percentage of Rhode Islanders who got their flu shot. How are we doing this year, and what's the worry that you have and your colleagues have?
What we've seen from other places in the world that typically precede what we've seen in Rhode Island is that countries and populations are having a worse flu season compared to usual. I'm reminded that that's most likely because we've been taking all these precautions to protect us against COVID. Those precautions, of course, have also protected us against flu, and now there's a little bit less immunity in the population. So countries in the southern hemisphere and elsewhere are seeing a little bit of a more severe flu season than typical. So important to get your flu shot. Really want to encourage people to get vaccinated for the flu.
And then did we get a little bit of a false indicator because we had that warm weather all the way through the middle of this month functionally? I mean, we had spring through mid-November. It was the extraordinary season. Does that now going to expedite sort of the spread of flu as everybody comes inside? It's now 30 degrees and everybody's going to intermingle over the holidays.
Exactly. We are expecting an uptick. Certain places in the United States, the southern states, which again usually precede what we see here in New England, are seeing an uptick. We have over 150 cases that have been diagnosed at our own state health lab. That's of course an underestimate of what's actually going on in the community. But we're starting to enter. We're at the very beginning of flu season. And so again, just want to do everything we can to mitigate the spread of flu.
And is that, are there some danger zones, some danger ages that we really need to make sure that they get the flu vaccine ASAP?
Yeah, especially the younger populations and the older populations. Again, those that are most vulnerable. The one thing about COVID I'm reminded is that it tended not to affect the younger population, but flu can be very serious in younger folks, and it can definitely be serious in older folks. So definitely for people that are immunocompromised, that are older, that have other medical conditions, should get their flu shot. I've already vaccinated my kids, 11, 15, and certainly would strongly encourage others to do the same.
Okay, now let's go to the third, the trifecta, RSV, hitting young children very, very hard. We've written about Hasbro, backed up out the door. Functionally people go in, put their name in, and go wait outside or in their cars. This does not seem like an American healthcare system at this stage, but it is the best we are cobbling together in a very complex situation. What should parents be doing right now to fend off that RSV?
I think the first thing to realize is that RSV is something that's been around for decades. We've known about it. A number of folks have come up to me and said, I've never heard of RSV. What is it? Well, it's another respiratory virus like the common cold that's been out there really forever, for decades, that we've known about. In most people, in adults, in older kids, adolescents, teenagers, it causes literally a common cold, something that all of us have had. It's that infectious, not anything to worry about. In younger kids, though, we're talking 1, 2 years of age, because their airways are so small, it's something that can block off their airways and cause them to have really severe pneumonia and breathing problems. It causes a spectrum of illness. There's not a lot you can do. It's what we call supportive care. So if people, again, have questions, if their kids are sick, do check in with your primary care doctor or other provider about what to do, especially before you go to the EDs. Obviously, if it's a medical emergency, if your kid is gasping and can't breathe, go to the ED. That's what they're there for, life-threatening situations. But for more milder illness and you're not sure what to do, definitely check in with your primary care provider first.
Okay, and then let's talk about behavior. So, I don't know, 6 weeks ago or so, we went to see Tina at PPAC, and I would say maybe 10% of the audience had masks on, maybe a little more, maybe 15%. This weekend, Kate went over and saw Les Mis with her nieces, 40, 50, 60% of the audience was wearing masks. Is that good thinking by people to really try and protect themselves in these large venues with lots of people that they don't know during this period of time? Should they take that extra precaution?
I think it is at this time. I mean, I'm personally masking. I was on a plane a couple weeks ago. I masked. I go to the grocery store. I went to the grocery store yesterday for Thanksgiving. I did wear a mask. I think in larger indoor crowded settings, especially in smaller spaces, it makes sense to mask. Our official recommendations, and we're still following the CDC, which says when we have medium or higher community levels, then our official recommendation will be to mask. But I think to your point about especially moving indoors, especially with RSV and flu, is that I think it makes sense personally to me to mask indoors in public settings, and that's what I'm doing when I go out.
Okay, give your, you get the last word. What's the suggestion to everybody as they get together for Thanksgiving besides hot gravy? Beyond hot gravy, what else are you recommending from a public health standpoint?
Be safe, definitely get out there, socialize, enjoy our time. We've also learned from the pandemic how important it is to socialize and not be isolated. Basic precautions, if you're sick, make sure to stay home if you're sick, and especially if you're going to go socialize with grandma, that may not be a great idea. Indoor crowded settings, wear a mask, get your flu shot, get your COVID vaccine. Do the things that you have some control over to prevent the spread of these illnesses.
Dr. Phil Chan, as always, greatly appreciate you taking the time. For everybody, have a great Thanksgiving. I urge you, get that flu shot, and if you haven't gotten that last booster shot, makes a big difference. I was talking to Dr. Chan before we came on the air, probably the least place you want to be over the next few days is the emergency room at Rhode Island Hospital. It's just stacked up like cordwood. 8, 10, 12-hour reports of waiting times is what we get here. So be safe, be smart, get the flu shot, get that booster shot, and have a great, healthy family get together. Thanks, everybody. We'll have much more. News does not stop. Obviously, the big hospital merger. We'll have much more on who the players are in that gig. Thanks, everybody.